Wow, good morning, good afternoon, good evening, depending the time and the zone over the region where you're watching from. It's me, Opio Nathan, once again on Hist Health TV. I have come with a new topic concerning health. Last time we met, yesterday, we looked at UTI, urinary tract infection. Today, we are here now to look at briefly vaginal infections. We shall be bringing in bits, but I request you always subscribe, like and share so that we may get all the lessons, all the topics. Because yesterday we looked at UTI small part, we didn't finish. We are coming with other videos to finish. But today, let's look at vaginal infections. So many people, many Ugandans are out there. They think UTIs are the same as vaginal infections. That's why when someone comes to the clinic, he says, or she says, I have infections, doctor, and I've come for treatment. And most of them claim, I want injections, I want this medicine that goes in the cannula or through the cannula. Because for them, they assume everything they get is the same infection. But there is a difference between UTI and vaginal infections. So UTI, as we said yesterday, this is the presence of disease-causing organisms in the system where urine passes. That's in the urinary tract. But however, vaginal infections, these are typically infections within the vagina here, or the vaginal open, the vulva there, not in the system where urine passes. So vaginal infections are totally different with UTI. There is one feature or one symptom that you can look at and know that this is a UTI or this is a vaginal infection. What is that? That's what we call discharge. Discharge is having something coming out of a woman's part. Let me be open, the vagina, the vaginal opening. When you see something coming out from there in form of a liquid, that's what we call a discharge. I'm not meaning blood, but any watery thing that comes out, it is what we call a discharge. So when you get an abnormal discharge, just always know that is a sign of a vaginal infection, not UTI. When you ever get an abnormal vaginal discharge, always know that that is now what we call a vaginal infections. So vaginal infections, there are many. For example, we have what we call bacteria vaginosis. We have what we call trichomatis or chlamydia trichomatis. We have what we call vaginal candidiasis. But we shall come and explain one by one. But today, I just wanted to bring you something small. When you ever get a discharge that is abnormal at home, what can you do? Before then, let's first understand what is an abnormal discharge. Because this is how God created women. There is always that water, the small water that comes out of the lady, which is called a vaginal fluid, which is very normal. All women have that water. But the normal water, or the normal fluid, it is colorless, it is not itching, it does not stick, like it is not slippery, it is like water. So God made it that their body over there, that part, the private part of the women, it keeps on cleansing itself, getting rid of the foreign microorganisms so that it may be safe. But sometimes it is affected by other microorganisms like fungi, like yeast. So when these germs or these microorganisms attack that part, they may develop vaginal infection. That's why the discharge changes. Sometimes commonly the discharge might be whitish or cream. It is thick, mataga food like spoiled milk. Sometimes it is too much itching, sometimes it's slightly itching, sometimes non-itching. Sometimes the discharge may be greenish in color with a smell like rotten eggs. Sometimes the smell is like fish smell. Sometimes the color is yellowish. So whenever you see those kind of features, maybe you have a white discharge, which is like spoiled milk. Maybe you have a greenish discharge. Maybe you have a yellowish discharge with offensive smell. Like it is too smelly. It could be like rotten egg, like fish. You get it? It could be sticky, like stick. Now when you it is slippery. It could be light. It could be itching or non-itching. If you get such symptoms, just know you have a vaginal discharge. So what can you do at home? Even before you visit the hospital, we recommend to use plain yogurt. Plain yogurt. Yogurt that is not having flavors or that is not having sugars. Because on market we have yogurts that have vanilla in them, those of strawberry. So such yogurts are not recommended. You have to use plain yogurt, that one that is not sweet. So how do you use it? Two way. You can either drink or put down. But better put down. Or better do both. Because you have to wash your hands with the soap and clean with a clean towel. Then you can get the yogurt, small part of the yogurt, then insert inside of the vaginal opening. Or you can even use an applicator. There are those, I think most of the women, you've inserted drugs down there when you have discharges. So you can use that applicator to get some little yogurt, then apply. Next video I'm going to come with an applicator and I try to demonstrate how it is done. So you can try to do that. You can even be taking, as you, not this very one, you put and take. You can have maybe 2 packets. Another one you can be using to apply down. Another one you can be taking. They all help to prevent and also manage the discharges. The day you notice that there is a discharge that is abnormal, use plain yogurt. I can assure you it will go. But when the discharge persists for 3 days, maybe it is also accompanied with fever, high body temperatures, maybe it is becoming so much itchy, there's a lot of pain, I advise you to seek for medical attention. This is what I wanted to share with you. Please use plain yogurt, and if you've not understood well, we shall share our number. You can always consult from us. We remain East Health TV. Thank you for watching.